I'm going to sign the new proclamation, please.
Sir, this is a proclamation both commemorating the 90th anniversary of the Social Security Act, the signing of the Social Security Act, and also the incredible accomplishments of your administration fixing and promoting and safeguarding Social Security. And it also obviously mentions the fact that as part of the One Big Beautiful Bill, a vast majority of our senior citizens are no longer paying taxes on their Social Security benefits, as you promised in your campaign and as you delivered for the American people.
That's a big factor, isn't it? Huh?
Yes, sir.
That's great.
Social Security is the Old Age Survivors and Disability Insurance, OASDI, program run by the United States Social Security Agency, SSA. Over 72 million Americans will collect Social Security benefits in 2024. Those Americans must be at least 62 years old and have paid into the system for at least 10 years prior to receiving benefits. Next, Medicare is the federal health insurance program for American citizens over the age of 65. Some people receive Medicare because of disability that qualifies them for the benefits. Medicare, like Social Security, is supported through payroll withholdings, hence why they are called entitlement programs. Lastly, Medicaid is a joint federal and state program which provides health insurance to lower-income families and individuals. Medicaid also covers medical costs not routinely covered by Medicare. Each state runs its own Medicaid program, but the federal government provides, at the very least, nearly half of the funding. These entitlement programs provide essential services that retirees and needy depend on for the subsistence of their living. This is not something that the government should play around with. Some of the problems facing these entitlement programs is the fact that they are projected to run out of adequate money to meet the demands. For example, with the Social Security benefits, current projections find that the program will run out of money by 2034, according to the Nonpartisan Committee for Responsible Federal Budget. Medicare is facing much of the same projected crises in the near future. The United States government needs to act by enacting a reform to raise the Social Security payroll tax cap. By raising the Social Security payroll tax cap, there will be an increase in the level of income at which the Social Security taxes are reapplied, specifically to income of more than $400,000. This would eliminate nearly 61% of the financial shortfalls facing the Social Security entitlement program. Another reform is to change the cost of living adjustment calculations. This would, in essence, change the way Social Security is adjusted every year, away from the Consumer Price Index for urban wage earners and clerical workers, and instead be adjusted according to the Consumer Price Index for the elderly. When push comes to shove, the most important thing is to avoid cutting benefits for the most vulnerable and elderly who rely on these entitlement programs they paid into.